A biotech company just received one of the rarest designations the FDA gives out. It is called Breakthrough Therapy Status. Wall Street's reaction? 14 analysts, 0 sell ratings, 0. In the next 8 minutes, I am going to show you 3 things. 1. Why this company just cleared one of the biggest regulatory hurdles in all of biotech. 2. A clinical trial result so rare, most drugs never come close to this number. 3. Why analysts believe this stock could more than double from where it trades right now. The company name and ticker. I will give you those at the end, but by that point, you will already know exactly what you are looking at. Quick note before we go deeper. We drop one of these every single day at 5 p.m. One stock, deep research, no noise. If you are not subscribed, you are missing the alert. Hit subscribe now, takes 2 seconds, and let's get into this. Reason 1. This company is targeting a condition where the FDA has almost nothing to offer patients right now. There are millions of people suffering from a condition that has no approved cure. No treatment that addresses the root cause, just symptom management for life. This company's approach goes directly after the source of the problem at the deepest biological level. That is the kind of scientific edge that makes the FDA pay very close attention. But here's the twist. The FDA did not just fast-track this drug. They gave it their absolute highest level of priority review, breakthrough therapy designation. That status is reserved only for drugs that show early clinical evidence of substantial improvement over anything currently available. That is not a small thing. That changes the entire timeline toward approval. Reason 2. The clinical trial data is unlike anything I have seen in this category. Every single patient in the Phase 1 and Phase 2 trial responded to the treatment. 100% response rate. Think about what that means. In a condition that has no approved therapy, not one, this drug produced a measurable, positive response in every patient it was tested on. The FDA reviewed that data and immediately said, "We need to accelerate this." And this is where it gets crazy. The company just dosed the first patient in its pivotal trial. The trial that leads directly to an FDA approval filing. Enrollment is advancing across multiple sites right now. The trial is on track to complete dosing in Q2 2026. That clock is ticking, and the market has not fully priced this in yet. Reason 3. The institutional money is already moving, and nobody is talking about this. In the last 30 days alone, Wells Fargo issued a buy. Cantor Fitzgerald issued a buy. Jefferies reaffirmed their buy rating. BMO Capital weighed in. Multiple major Wall Street firms, all pointing in the same direction, at the same time, on a stock under $5. When that many institutions move together on a small company, that is not noise. This changes everything when you see the full picture. Now here is the number I want you to focus on. $10.78. That is the average 12-month price target across 9 Wall Street analysts covering this stock right now. The current price? Under $5. Do the math. That is more than double from today's price, and that is the average, not the high. The most bullish analyst on Wall Street has a price target of $19 on this stock. From under $5, the market has not caught up yet. But the pivotal trial data, coming in Q2 2026, that will be the moment everything accelerates. So, you have seen the clinical data. 100% response rate, FDA Breakthrough Therapy designation. You have seen the institutions, 9 analysts, 0 sell ratings, 14 straight buy calls. You have seen the number. Average analyst target more than double the current price. Now it is time to name the company. The stock I have been talking about is Taysha Gene Therapies, ticker symbol TSHA, trading on NASDAQ, under $5 right now. This is a clinical stage biotech developing a gene therapy, a treatment that targets disease at the genetic root cause for a rare condition that currently has 0 approved options for patients. And here is the last thing I will leave you with. This company recently regained full rights to its lead drug after a partnership agreement expired. That means 100% of any future value, any approval, any licensing deal, Any acquisition offer flows directly back to shareholders. No partner taking a cut. Full control. Full upside. Now I want to hear from you. Gene therapy is one of the most exciting and most risky areas in all of biotech right now. So here is my question for the comments today. Do you think FDA breakthrough therapy status is enough to take a position before the trial data drops, or do you wait for the actual readout? Drop your answer below. I read every single comment. Tomorrow at 5 p.m. Another alert, another opportunity. Make sure you are subscribed so you don't miss it. Before I go, a quick but important note. Everything in this video is for informational and educational purposes only. It is not financial advice. It is not a recommendation to buy or sell any security. Investing in stocks, especially small cap and biotech stocks, involves significant risk, including the possible loss of your entire investment. Always do your own research. Always consult a licensed financial advisor before making any investment decisions. Past performance does not guarantee future results.